Hi, my name is Dr. Philip Wrotslavsky of the Advanced Foot and Ankle Center of San Diego, and welcome to The Fix. Today it is our pleasure to be joined with by Dr. Kelsey Millonig from Des Moines, Iowa. Welcome, Dr. Millonig.
Thank you.
Tell us a little bit about your practice.
So I practice in Des Moines, Iowa at East Village Foot and Ankle Surgeons. I'm a Farm, Iowa native kid, and so I love being back in Des Moines, and I specialize in, of course, this complex deformity correction.
So you brought with us a great case today. Tell us a little bit about this case.
So this is a 73-year-old patient. He had a post-traumatic deformity. He's a horse trainer and has had this deformity for over 20 years, and of course has developed ankle arthritis as a subsequence. So he has a distal tibial recurvatum and verum deformity.
So they come to your office, patients like this, and how do you decide what surgery is needed?
Yeah, so for this patient particularly, because he had both the deformity correction as well as the ankle arthritis, we had a lot of conversations about how is this going to work for this patient? What are your goals after surgery? And he has goals to be able to walk multiple miles a day, work on the farm. And because his leg is also almost 3 centimeters short, we have to talk about lengthening the limb as well. So for him, it became a very clear choice to move towards the X-Fix option for this patient.
So you work up the patient, you check their range of motion, you make sure that they're optimized metabolically so they can heal, and you have to measure the magnitude of the deformity, which means how big the deformity is. So how do you measure that, and how are you using that for your surgeries?
Yeah, so the preoperative workup for these patients is so critical, and you have to do all the deformity planning ahead of time, which is something that I really specialize in from my fellowship training. And so with the deformity correction, I use the Hexapod software program, which allows us to go through and say this is where the apex of the deformity is on the frontal plane, the sagittal plane. What does that look like, and where could I make my bone cut as well, so that I can go ahead and correct this for the patient and then also lengthen them out over time.
So you got a plan now.
Yeah.
And you explain this all to the patient, and you then go to the operating room. So what happens when you're in the operating room, and how do you carry out your plan and turn it into a reality in the operating room?
Yeah, so again, with my preoperative plan, I went through probably 5 or 6 different options on how I was going to do my frame construct, and once I landed on one based on my deformity planning, first I start with my soft tissue releases because we're fixing the bone, but we have to think about our soft tissue. And so I go through those soft tissue releases, and then I start my frame application. And when I get to my osteotomy or my bone cut, I had also planned that out preoperatively to decide to do a focal dome osteotomy in the sagittal plane, and I did that through minimally invasive incisions because I really wanted to limit this patient's soft tissue compromise due to his age.
So the surgery goes off, and you apply the device onto the deformity, and you do your soft tissue releases. What happens after the surgery?
So after the surgery, again, we take our big x-rays and we upload them to that Hexapod software again, and we get to go through all the deformity planning again and make sure, what may have shifted or changed during surgery. And then what that does is it creates a program for me then to give the patient that says, these are how we're going to go ahead and turn these struts so that over time you can lengthen your leg, we can make it straight again, and it'll take a process of about 60 days or so depending on how long it takes to lengthen and do all of those things.
So this TL Hex device that's applied to the patient has, you mentioned, struts. So they're all color-coded, and they have numbers on it, and you give them some sort of formula to turn these. So tell us how that happens.
Yeah, so again, it's all based on your deformity planning, and the computer software program is a really great option because basically what it does is it allows you to say, these are my deformities in multiple planes, and let's make them into 6, And then I give this patient a program that they can follow along, just go through with a check mark and turn their struts based on it each day, and we can gradually correct the deformity as well as lengthen the limb, and then they have to stay in the external fixator until we see more bone production. And we evaluate that through x-rays as well.
So the reality is the patient's actually correcting their own deformity.
Yeah.
They're part of the team.
They're part of the team. Everybody's part of the team.
Yeah. So how long was this correction?
So this patient's particular correction took around 65 days, but again, because we have to wait for the consolidate to form, they're in the frame longer than that.
So the actual correction that you're growing the bone is 65 days, but the reality is that's soft bone.
Yeah.
So if you take off the device and they step on it, it's not solid enough to step on. So you're waiting, when you say consolidate, for the bone to become hard.
Yeah, I kind of explain it like candy. Candy is just poured in a mold, it doesn't do anything. If you take the mold away, it's just gonna fall apart. Bone's kind of the same way. You have to have a mold, so you have to have the X-Fix on until it's molded.
And how does this patient do in the end?
Patient's doing great. I'm really excited to get back to their activity level, get back to work, but we gave them a straight leg, which was our goal at the end of it.
That's a fantastic case. Thank you, doctor, for sharing that with us.
Of course.
And thank you for joining us on The Fix.